Good afternoon. We have been learning about blood clots, and currently I am in my car about to go home, closed for the day, and I want to share this week's real stories that keep me fighting. This week alone, I have managed 5 clients with blood clots, and these are not just medical cases. Behind every clot, there are mothers, there are fathers, there are sisters and friends. So what are the patients I have seen this week? On Monday, the week began with a success story. I managed one of the ladies who had developed pulmonary embolism during pregnancy. We put her on blood thinners, and Monday's visit was the last visit on completion of treatment. We did a CT angiogram, which was normal and showed there was no clot in the lungs. Her echocardiogram to assess the heart was also normal. The strain on the right side had recovered. And I actually discharged her from the clinic to continue with the preventive measures and to come see me next, or her gynae, when she was pregnant again, when she would be put on prophylactic blood thinners. The other patient I saw again on Monday was a patient I've been following for a number of years. She used to get recurrent DVTs and pulmonary embolism, last episode being 2023, and we put her on lifelong prophylactic blood thinners. She takes rivaroxaban 10 milligrams once a day and comes to greet the doctor once every year. She has not had an episode since we put her on the prophylactic blood thinners. 2 of the next patients I saw were admitted in the ward. One sadly got a clot because she had presented with the bleeding and was bedridden in hospital, and hence could not be put on blood thinners. She developed DVT, and these are challenging cases. You cannot treat the DVT because the patient is bleeding, and our only option is to put a patient with what we call an IVC filter. You put a filter in one of the main veins to prevent the clots moving to the lung. The other patient who was also admitted was in ICU. She developed a clot in her upper arm after having a central line. A central line in the arm led her to develop a clot, and she was put on treatment doses of blood thinner. The 5th gentleman, we discharged him yesterday. He had actually presented about 2 weeks ago with severe headache and was thought to have meningitis, but on further testing he was found to have a clot in one of the veins in the brain, which is what we call cerebral vein thrombosis. I co-managed him with our neurologist. What does this show us? Within a span of 1 week, I have managed to see 5 different patients with blood clots. Blood clots are not rare, they are common. That is why I'm passionate about raising awareness about blood clots. Most of the blood clots are preventable. Know your risks. Are you at risk of developing blood clots? And if you are at risk, take the measures to prevent you from getting blood clots. And if you developed the signs which we have covered, breathlessness, leg swelling, chest pain, please go to hospital for early diagnosis. Our posts today were on diagnosis of DVT and pulmonary embolism. Remember, if you have a clot can be treated successfully. I've just mentioned the lady we saw on Monday who is very happy, and we are looking forward to the next pregnancy. And clots can be treated successfully. Know your risk, take preventive measures, discuss with your doctor if you need any measures or medication to prevent the clots. And if you have had a clot in the past, stay on top with your follow-up, regular follow-ups with your doctor. If you have had recurrent clots, you are meant to be on indefinite prophylactic drugs to prevent you from getting another clot, especially if the underlying risk was not known. So please, let's keep talking, let's keep sharing, and let's keep saving lives. Dr. Muthui-Mutua, saving lives one heart at a time. Have a blessed weekend.